A successful pilot project to make patient care easier and more cost-effective was recently carried out at the Sándor Károly Hospital. A pilot project was recently completed at the Sándor Károly Hospital, which was intended to improve care conditions in the field of incontinence treatment, both for the nursing staff and for the patients. Another important aspect was to reveal previously hidden additional expenses and sources of problems, and to ensure treatment at a lower cost. The daily costs for incontinence treatment declined by 22% during the test. The results of the pilot project were discussed at a press conference at the City Hall in Újpest. Dr. László Iván, a geriatric physician and member of the Healthcare Committee of the Hungarian Parliament, presented a positive summary of the project's results. In contrast to previous efforts of this kind in the past, the project achieved much more accurate, targeted, and tangible positive results. We cannot really express some of the results in forints, as a separate study will be needed to assess these aspects. The consequences of this project can also be expressed in forints, but there is a tangible improvement in the quality of life for the caregivers and the patients involved, as well as for their loved ones. During the press conference, the mayor of Újpest stressed that the most important aspect was improving the comfort of those involved. It's really the case that the level of comfort improves for both the staff and the patients. As mayor, however, the most important thing for me is that the people who are admitted to the hospital for treatment, perhaps because they cannot care for themselves, these people are our friends and our loved ones, our parents and our children. The most important thing is that they're more comfortable. I think that that is the most important aspect. The 3-week pilot project had several positive results, according to Dr. Antal Holosi, head doctor at the Sándor Károly Hospital and member of the Healthcare Committee of the Hungarian Parliament. During the first week, experts came and surveyed the situation, experts from the company, working in cooperation with the Inpatient Care Administration and the nurses on duty. During the second week, they delivered the products and explained their use to the nurses, and they carried out the work and procedures themselves during this introductory phase. During the third week, the work and procedures were carried out together, working jointly with the staff. From the end of the third week, the nurses were able to do the work independently. Naturally, all of this was supported with appropriate data collection and entry and calculations. In the end, we held a final meeting together with the hospital management. A summary of this meeting was later compared to the results of a similar project at the Aladar Pets Hospital, and it doesn't surprise me to say that the results there were good as well, and that our results were good too. Incontinence is a problem that affects about 5% of the total population, and it's a problem that's becoming more and more significant as the population ages. Treating incontinence is one of the most common and most serious nursing tasks at institutions providing inpatient medical care.